Good evening, everyone. Sorry for this delay. On behalf of International Homeopathic Foundation, welcome you all today. Before we move forward, let us pray for 1 minute for these noble souls. Shri Hamid Hussain, who is father of Dr. Tanveer Hussain, and he left us today. Dr. Vishpala, इनके बारे में सब जानते हैं, and she was a well-known name in homeopathy. Mrs. Vinita Dharyani, wife of Sir Dr. J.D. Dharyani. And please for 1 minute इन सब के लिए हम लोग प्रे करते हैं. ओम शांति, ओम शांति, ओम शांति. So just a small introduction of IHF to the people who are new to IHF. IHF was founded in the year 2015, which aims to promote homeopathy through academic and integrated approach. Since inception, we organized various free health camp seminars, homeopathic medical education series. The most talked about 3 days successful International Homeopathic Congress was organized at Taj Vivanta, Dwarka in April 2016, where more than 250 doctors, researchers participated globally, and Dr. Gyan sir was also there with us. So during COVID-19, we had eminent speakers where we had a mega virtual international homeopathic mega discussion, which includes the homeopaths, allopaths, dietitian, yoga specialists, and people from CCRH as well. So without wasting much time on that, IHF has proposed credit system for homeopathic doctors to Ayush department. IHF has also started a learning program, which is Let's Learn Together, and we have completed more than 160 days now. The management team of IHF consists of Dr. Wahi, Dr. Muktinder Sir, Dr. Amita, Dr. Bhavna, Dr. Monica Singh, Dr. Gurbeet, Dr. Suman Sachdev, and Dr. Vinod Madan. We welcome you today, Dr. Gyan sir, and your topic is very interesting with this hope, heart, and homeopathic approach towards infertility patients and some clinical experiences. So I request Dr. Monica to introduce Dr. Gyan to our audience, please. Dr. Monica.
Amita. I'm audible?
Yes, yes.
Yes, ma'am.
Yeah, a very good evening to all. Today we have Dr. Gyandas Wadhwani with us with an interesting topic of homeopathic approach towards infertility and his clinical experiences. Dr. Wadhwani is MD in Organon of Medicine from SGND Homeopathic Medical College and Hospital, Ludhiana, practicing in New Delhi. He is member of Order Superior Groups, South Africa and New Delhi. He is editorial board member of American Journal of Homeopathic Medicine. He has been conducting monthly lectures on Materia Medica, homeopathic philosophy, clinical prescribing, and repertory on various platforms. He is former Chief Medical Officer, NFSG Homeopathy, former Senior Lecturer, Organon of Medicine and Homeopathic Philosophy at Dr. B.R. Sood Medical College Hospital and Research Center. He has conducted a series of workshops with practitioners of Order Superior Group of Homeopathic Associations of South Africa and New Delhi. He has personally studied under the guidance of some world-renowned physicians like late Dr. U.T. Advani, late Professor Dr. Diwan Harishan, and Professor L.M. Khan. He is author of various scientific and clinical case study papers and also presented them on various national and international platforms, published numerous papers and case reports on COVID-19 and homeopathy, after treating more than 8,000 patients. He is receiver of many awards. To name few are Certificate of Excellence for Meritorious Services in the Field of Homeopathy in 2014 by Directorate of Ayush, Government of NCT of Delhi. Dr. D.P. Rastogi Best Teacher Award in 2012 by Board of Homeopathic System of Medicine, Delhi, etc. With this introduction, we welcome you, Dr. Gyandas Wadhwani.
Thank you.
Over to you.
Thank you. Thank you.
Thank you, Dr. Monica. Over to you, Dr. Gyan. Just give me a few seconds so that I can start your slide.
Thank you.
Is the slide visible to you, sir?
Absolutely, ma'am.
Okay, okay. You can tell me when to shift the slides. I'll do that.
Perfect.
Okay.
Perfect. Thank you.
Thank you.
Respected seniors and dear colleagues and friends, first of all, I truly apologize for delaying everybody. Um, uh, so I am really sorry for wasting your time and making you wait. But I hope that, what I share with you today will make this wait worthwhile. And before I move further, I would also like to convey my heartfelt condolences to Dr. Daryani on the passing away of his wife, which I just came to know about. Please do accept my wholehearted condolences. For last few years, I have started using, and in fact, just like Organon has a motto, which means ode sapere or day to know. So for my clinic also, I have created a motto, which we call Hope, Heart, and Homeopathy. It is visible on my visiting card. It's visible now on my glow sign board at the entry of my clinic. And in fact, I've used this prefix in many of my case studies that have been published. I received a call from Dr. Daryani sir yesterday that what do you mean by hope, heart, and homeopathy? And why do you use it? So, with complete humbleness, I wish to share that any patient who comes to a homeopathic doctor, he comes to the homeopathic doctor with a certain hope, and many a times that hope has been crushed, or many doors have been shut on his face, and he or she is not able to recover. And then he approaches a homeopath with a certain kind of hope, uh, whether that, with that hope that he shall be able to help uh, that person with that particular ailment or that particular problem, whatever he or she is suffering with. And many a times, as homeopaths, we come across cases which are considered to be surgical or incurable or non-responsive. And the homeopaths, because they're usually guided by the motto of ode sapere, they always have the heart to take up all these cases. My seniors like Dr. Wahi, Dr. Daryani, and they've had much more experience than me, but uh, so many times homeopathy has come to rescue in all these patients in all these conditions. And in fact, the topic today that we discuss about the infertility patients, which has also become a huge challenge in an increasing challenge. In fact, in last couple of years, the numbers of infertility patients are just increasing by the day. So that heart and the courage of the homeopath to take up all these cases. And homeopathy is the last part of the prefix, but the most important one. Homeopathy is what brings us all together. It's a profession that is a calling. It's not just a profession for us, it's a calling. Homeopathy is what gives me this opportunity to share my experiences with you and wherever else I've traveled in the world. Homeopathy is what gives me a credibility and a place in the society at large. And homeopathy is, as I said earlier, it's not just a profession for us, it's a calling. It's a calling because of which many of us, who've probably had an opportunity to become conventional doctors or go into other alternative forms of therapy, but uh, we are uh, uh, we have a united mission, and that mission for us is homeopathy. And that's why, sir, I started using this prefix, and uh, many cases that I've published are carrying now this prefix. And uh, uh, in fact, one of my cases of infertility is also under submission and consideration for publication. It'll take some while, but it'll come about. And that is also one of the cases I'll share with you today. Uh, so that being said, now infertility, Dr. Meeta, can we move to the next slide, please? Infertility is
Yes,
a
sir.
subject, which is uh, uh, interested the humanity since the onset of life. And this is a painting which was painted by the famous Renaissance artist Leonardo da Vinci. It was also on the process of reproduction. What was so famous about Leonardo da Vinci was not just his interest in sciences, but what is truly visible in this painting is also his ability to write as a mirror image. So that's what you see. You'll find it difficult to read, but people used to read whatever he wrote on his paintings or in many of his writings in a mirror format. He was quite gifted. He has somehow displayed graphically the process of reproduction, but there are quite a few flaws in this. For example, he believed that uh, the semen arose from the brain and it traveled through the spine, and that's how it was transferred. He did not understand that the formation happens in the testicles. And the other thing, uh, which he uh, considered was that that the breast tissue and the nipple especially is directly connected to the uterus through some tube. So these are two pretty obvious strong flaws. There are many other flaws in this painting, but it shows how uh, since antiquity, humans have been governed by the process of reproduction. And of course, we are there today because of the process of reproduction. And uh, uh, Leonardo da Vinci was one of those who had the courage to first and foremost give a very graphic demonstration of this act of reproduction. Dr. Meeta, if we can move on to the next slide, please. So, infertility today, clinically, if we say we consider infertility as a condition, as a clinical condition, or as a diagnosis, when any couple who are cohabiting together, that means they are staying together for a period of at least 1 year, and they have regular and unprotected sexual intercourse, and especially in the fertile period, which we all know today. We have many apps which help you identify the fertile period. And generally we say a period of 1 year because statistically they say that it takes about the possibility of conceiving in any month with a regular menstrual cycle, and especially if you've had intimacy during the fertile period, the possibility is about 20%. So if you've had regular intercourse over a period of 1 year, then and you're still not able to conceive or maintain a pregnancy, then infertility is considered as a diagnosis, not before that. And like I said, that over the years, the number of infertility patients are increasing, and it's a multi-million-dollar industry. In India and globally, it's considered to be a multi-billion-dollar industry. And if you have traveled on the ring road of Delhi at any point of time, for example, if you leave from Lajpat Nagar, where I have my clinic, and you go, say, for example, to Punjabi Bagh, on the ring road alone, you will find at least 10 infertility or IVF centers. That is how big a challenge it is. And uh, there are so many fertility clinics which have come up in last 10 years, and it is much more than any other kind of specialty center or clinic that has come up in any city especially in the North India. That's how they say it statistically. So it's a huge challenge. But when it comes to homeopathy, an approach to a patient with infertility is precisely the same as our approach towards any patient with any chronic disease condition. Uh, whatever be the diagnostic condition, acute or chronic, uh, the fundamental principles of homeopathy stay essentially the same everywhere. So the treatment of infertility patients for homeopathy is not very different from any other chronic disease condition. But of course, the approach might be altered a little considering the understanding, the diagnostics that are run, the and the general management part that is required will be different from other disease conditions, chronic disease conditions. But essentially homeopathy, with its very fixed principles, like in the introduction, the preface to the fifth edition of the Organon, Hahnemann says that homeopathy is a perfectly simple system of medicine, remaining firm and quite fixed in its principles. So the role for any homeopath is very simple. You have to find out the characteristic totality of symptoms of the patient, and then you have to compare it with the characteristic totality of symptoms in the materia medica, decide the more appropriate remedy. Now that can be done either with the help of repertory, or if you have a thorough knowledge of materia medica, you can probably arrive at the remedy just by a knowledge of materia medica. And after that, you just have to decide on the more appropriate potency. Posology is the next challenge. And last, of course, you have to wait, and you have to make sure that the obstacles to recovery are taken care of. And then you have to just allow the medicine to act and change the vital dynamics. And I do not say that, we've had 100% success rate in treating infertility patients, but I believe that most of the patients that we have been able to treat of infertility have given us quite a reputation. And we on an average, we have about one new patient of infertility consulting us every week among the other patients. So have had a sizable. So but there are some aspects which you have to keep in mind, like for example, about uh, about 7 years back is when a patient came up to me with his wife, and they came from a pretty wealthy family, quite financially well off, but they had uh, a very orthodox outlook towards life. 7 years back, so I'm talking about somewhere around 2016 or so. So though they drove up in fancy car, they were wearing fancy clothes, but the husband and wife had been married for about 4 years, and they had been trying to conceive, but they were not able to conceive. And the lady had a bunch of investigations showing that she had been to each and every doctor possibly available, from Apollo to Fortis, to their family doctor, family gynecologist on her maternal side, which was based in Calcutta, to her paternal side, which was based in Mumbai, and then, of course, the in-laws who were based in Delhi. So she'd been to so many doctors that run all sorts of diagnostics, but they said that everything seems to be all right. But what they missed out um, was that the husband had not run any possible diagnostics, and the guy was quite tall. He was about 6 feet 6 inches, and he had a very uneven body. The upper part, the chest and the arms were quite emaciated. The lower part, the waist and the legs, they were quite heavy. And I could see there was very little bodily hair. and his ears and his eyes were a little abnormal. And then the muscle tone also seemed quite flabby. He was wearing a t-shirt and you could see that the muscles are very, very flabby. And that reminded me of a phenomena, a medical condition where a man can have asymmetrical features on the face, can have very less body hair, can have a very flabby muscle, and these people can also be abnormally tall than the other people. And I asked them about their frequency of intimacy, and he said, okay, we have intimacy about 3 to 4 times a month. And then when I questioned the wife separately, she said, it's he's just not interested too much. So many times I have to force him to have intimacy. And then I asked him to go for a chromosomal analysis, and he was offended initially, but then I had to tell him that, possibly you're suffering with a disorder. And I explained to him, I asked him to read about it online, and he turned out to have Klinefelter's syndrome. And in Klinefelter's syndrome, you have an extra X chromosome, and it also leads to a condition called azoospermia with a very poor sex drive. And but the moment he came up with the chromosomal report, that was the second and the last time that I saw him, because he was too embarrassed, and I do not know what really happened. But as a doctor, as a practitioner, and more so as a homeopath, you have to be far more invested in the patient. And I believe that has its advantages or disadvantages. You have to work a lot harder than the other conventional doctors, and and of course, you end up um, uh, either winning a lot of patients or you get a few brickbats at times. But I think that goes hand in hand. So uh, but what I do know is that gentleman never came back. Eventually, the lady came back a couple of years later, and she had conceived through IVF, and thereafter she came with a baby. And she wanted to ask my opinion that, whether the baby is fine, does he seem to have normal features, or probably he also has some chromosomal abnormalities. And that, that I am not allowed to ask a pediatrician that, because the entire family accompanies. But I am surprised that, where many other doctors missed out that point, you picked it up and you could help diagnose. So um, but yeah, the child completely takes homeopathic medicine. So so we've won over one part of the family who believes now in homeopathy more than the others. But I believe as homeopaths, it's very, very important to know your diagnostics. It's important to understand the pathophysiology of different disease conditions, and especially when it comes to infertility. So, for males, especially, like for example, there's a major category of infertility which today is considered to be idiopathic. Uh, Now, when it comes to that idiopathic feature, I'm sure as homeopaths and as doctors, we know there are many articles which have been published, like in the stresses of the modern environment in the developed societies or in the developing societies, especially people who are staying in metro cities, they are having a diminished sex drive. Now, stress is one of the major, major factors for infertility nowadays. And I believe as homeopaths, I say that with utmost sincerity, uh, uh, and I do not say that with any uh, uh, how do you say any high-headedness, but extreme humbleness and sincerity. I say as homeopaths, we are the most well equipped to deal with patients who are stressed out a lot of times, because our medicines are not like antidepressants or anti-anxiety, which can sometimes affect your fertility levels. But we have our success lies in the twofold approach. First, of course, is that the case taking, the process of case perceiving, as my teacher Dr. Khan used to say, and many times in Organ on Human Rights, the process of homeopathic case perceiving. So the entire process of homeopathic case perceiving is quite therapeutic, because you analyze and go into each and every aspect of their life. You start with their family history and their personal history, their entire evolutionary history, from their all sorts of illnesses that they have come up against in their past, and their current health problems, whether they're related to infertility or not. And you go through the entire schema. You ask whether do you have any trouble with the head or eyes or nose or throat or ears or chest or limbs or digestion or urine, or your sleeping patterns and everything. And you ask about their life and circumstances, their experiences, the emotional psycho emotional traumas that they've gone through. And the entire homeopathic case perceiving phenomena is so therapeutic in that matter, that my teachers, of course, and my seniors, like Dr. Daryani, Dr. Vahi, would have heard it many more times, that after the patient gets up, they say, I feel heard, and I feel that half my problems have gone away just by talking to you, just by giving you this kind of a history, because this is what doctors don't do. And sadly, with the new trend in homeopathy coming up, where a lot of combinations are being used, where a lot of patents are being used, and where people are not really reading the organon and philosophy in great detail, and not spending enough time with the patient, in an attempt to see more and more number of patients, are spending lesser and lesser time. But if you go by the classic method, you end up spending time, and it not only gives you a lot of valuable information which helps you frame the accurate totality of symptoms, but at the same time it also um, is de-stressing for the patient, because they have an ability to voice all their psycho-emotional traumas. It gives them a window to express what they have suffered, either in silence, or they haven't been able to voice it out properly. So that de-stresses them to a great extent, and then you can educate them about how to improve their lifestyle, how to avoid sitting for a longer period of hours, which can imbalance your hormones, which can also impact the process of spermatogenesis. Uh, what kind of clothes they ought to wear, what kind of diet is good for them. It's an opportunity to improve their lifestyle in general. And today we understand lifestyle disorders, whether for example, there are certain dietary indiscretions, there are certain addictions, like I said, that obesity, the stress which can also impact your hormones to a great level, and also impact your sex drive to a great level. It is important to understand that prolonged sitting in women can lead to a lot of obesity and challenges. In men, it can affect because the trousers are tight when you're sitting for a longer period of time. It can impact and lead to various conditions which can impact your fertility as well. So, sleeping at abnormal hours, waking at abnormal hours. Today, many a times you find that, that the partners, the husband and the wife, they are working in different time zones. So somebody is working in India timing, somebody is working in US timing. So the possibility of infertility creeping up in that kind of lifestyle is also higher. So you have to attune them and homogenize them, and you have to synchronize their tuning, which also helps them overcome this problem of infertility which they're probably facing. So these are different aspects of lifestyle that you also cover up. So the entire process of homeopathic case perceiving can be very, very therapeutic. And uh, secondarily, the the aspect of the homeopathic medicine that you give, it's that constitutional prescribing which you introduce into the patient heals them from the neuropsychiatric level to the physical level to the endocrinal level, and it balances out a lot of problems and gives them the most unique way. So uh, remember one of the most challenging cases that I saw was in a lady who uh, was close to about 40 years, and her AMH levels were very low. They were about zero point 0.4. And uh, and she had been missing her cycle, and with the homeopathic medicine she was able to conceive. And the more than it's the satisfaction of having helped that kind of a patient, and the blessings that you receive when you help these kind of patients is beyond imagination, something which only when you experience yourself do you value it. So the entire process of homeopathic case perceiving, Dr. Amita, can we please move to the next slide? uh, so you know the homeopathic approach is very, like I said, is just like any other uh, chronic condition or chronic disease patient that we treat. We initially believe in the concept of anamnesis, where we get the entire history. And especially in the various aphorisms which are mentioned in the uh, organon, I especially would like to point out the aphorism 6, where Hahnemann says uh, that the homeopathic physician, uh, well aware of the futility of transcendental speculations, which can receive no confirmation from experience, notices nothing but the deviations in the state of health. So, what you have to keep in mind is that you cannot ever be guided by your past experiences. You have to treat every patient as a fresh case. You have to try to be as unprejudiced and as unbiased as possible. Never ever be governed by your past experiences in cases of infertility, or for that matter for any diagnostic condition. And wherever I travel in the world, with great humbleness I tell all my colleagues and my students that whenever you go to any conference or you listen to any lecture where people say that in my experience, please try and cover your ears, because you're about to be handed over a bias. Never ever be governed by biases. So I always say, always remember aphorism 6. Hahnemann writes very clearly, can receive no confirmation from experience. So no speculations when you're doing the history. Never be governed by your past or your teacher's experiences. Uh, so I'll just share with you an example. So I remember a long time back, this was about 20 odd years back, and I went to one of the seminars, and there was this very famous homeopath. And I hope and I pray that none of us ever become somebody like that. And he was talking about a case of uh, a patient who had uh, a reduced sperm count, and he had been through a lot of treatment, and his sperm count had failed to improve. So it was not really a case of azoospermia. In fact, I would like to share a case of azoospermia that I recently treated, and I could say that I cured. So uh, uh, he was talking about this case who had a very poor sperm count, which was about 3 million or 4 million. And there were a lot of pus cells that were showing up. And he'd been through courses of antibiotics and the sperm count had failed to improve. He'd been given many supplements. And, he said that when he read a remedy called Kilcaria hypophos, and he said that, he prescribed that in that patient and the sperm count improved and the pus cells disappeared. And he said, thereafter, I have experienced that, I have failed with many other remedies, but in my experience, Kilcaria hypophos is the remedy for such cases where the pus cells do not go and the sperm count is low or is of poor quality. Or, for example, for any generally when you go for a semen analysis, so the count has to be more than 20 million and more than 50% motility and more than 50% normal morphology is required for the person to conceive. So for basic normal fertility. So he said, thereafter, in all the cases of where I had failed with, to increase the sperm count or where the pus cells were not going away, I just use Kilcaria hypophos in a 3x or a 6x, and it works like a charm. And in my experience, is the specific remedy. And 20 years back, I was, just fresh into my practice, and I was just trying to, swim in the ocean of clinical practice. And I was my first few strokes, and I thought, okay, now I know there's a specific remedy in homeopathy for all such patients. And I gave it to one patient, two patients, three patients, four patients, over a span of 3-4 years. And I found absolutely zero results. And that's where I learned. And because, we've been taught by my teachers, all of my mentors, to always read the organon. And then, in one of the readings of the organon, I understood aphorism 6 very, very clearly, that what I basically received that way was a bias, and I tried to confirm it in each and every case. And this is not how homeopathy works. You have to see every patient as an individual. You have to prescribe the right kind of remedy. So, just recently, uh, I will share with you, in this small presentation that I prepared to share with you, I will show you that patient who was consulted. His wife brought him over, and he was, of course, he presented with absolute azoospermia. He and his wife had been married for about 4 years, and so they'd done the scrotal ultrasound. His wife's all tests and parameters were normal, and he had a zero sperm count. They did the analysis 3 or 4 times at 2 or 3 week intervals. After taking some antibiotics, after taking some stimulants and supplements, he underwent a scrotal ultrasound, which showed everything normal. There was no varicocele, which can also possibly trigger, a poor sperm count at times. They went through to through a biopsy to find out whether there's some possible reason. He went through many hormonal profiling and analysis, but the only thing that was visible, though, there was spermatogenesis or spermiogenesis was happening inside, but they could not figure out any blockage because of which the sperm was not coming out. But basically, he presented with absolute azoospermia, and that's when they said that, IVF is the only way ahead for you. And the wife and the entire family, they've been my patients for a long time, so they decided to consult me. And then they came to me about 6 months back, and I said, okay, we've had a few successes and a few failures, but yeah, there are a few cases of azoospermia that we've really helped. So let's give medicine for about 3 or 4 months and let's repeat the tests. So we went into the evolutionary history and the anamnesis. So he had a family history of uh, tuberculosis on the paternal side, um, and maternal side showed diabetes. And generally, both the maternal and paternal side were of heavier build. They had put on more weight, though they had no other metabolic disorders. And the patient himself was about, 6 feet tall and quite overweight. He weighed about 120 kgs, though he had been a very active sports person. He was working as an engineer and worked in an MNC, and he had very comfortable timings. And he said, I've always been active into sports throughout my school time, my college time, and after I started working, my lifestyle and my job has always allowed me time to play sports. And for example, even today, I play about 1.5 to 2 hours of badminton every day. As a family, we don't really eat out too much. We are majorly vegetarians in our diet. Sometimes we might take eggs, but that's about it. And I used to suffer with cold and cough as a child, but over the years that tendency for cold and cough has gone away. When I was about 12 years old, he said that he was diagnosed with cervical tubercular lymphadenitis, for which he was given ATT for a period of 6 to 9 months. He was not sure, but one of that, and then he recovered. And the parents informed that he had suffered with worms as a child. His general appetite was pretty good. His bowel, urine were fine. His thermal reaction was a little more on the warmer side. He had some preferences and liking towards sweet things, but nothing that was 3+ or extraordinary. And this is all the information that I could gather. There was no history of trauma to the genitalia. Like I said, the ultrasound had ruled out spermatogenesis, and there was nothing marked on the perspiration, except that, what I noticed was that he had hyperpigmentation in the neck and in the underarm area. And then I asked him to go for an insulin test, fasting and PP. So he did come up with some insulin resistance in the body. But apart from that, and he said that, he had been fortunate. He had a very comfortable life. Parents have been kind. And his wife did not stress him or harangue him. And he said, we give each other space. She's also working, I'm also working, we both have comfortable life. And if this doesn't work out, what you're going to do eventually, we'll have to go for IVF, or we'll consider adoption, and that's it. So all in all, there was nothing else that was found out. So for some 172 to 184 in the organon, they talk about one-sided diseases. So sometimes these conditions, for example, this patient with azoospermia has an absolute one-sided disease condition, where besides what is indicated by the test and what we also find out on observation, that he has a tendency to put on more weight, we find nothing else. So, we ran, we went through the history, and I meditated and I read. And eventually, given the fact that he had a family history of tuberculosis and that he had suffered with cervical tubercular lymphadenitis, he was prone to cold and cough as a child. I gave him Drosera in LM potency. And I put him on Drosera. He went from Drosera LM1 to LM6, and then we repeated his sperm count, and he turned out to have a 12 million sperm count. And when the husband wife they got the report in their hand, they could not believe it, so they reran the investigation at another lab. They called up the previous lab and checked with that hospital, are you sure it is 12 million? They said yes. So then they ran the test at another lab, and they also confirmed that the sperm count was somewhere close to 12 million, and they were ecstatic. And uh, that is the kind of result with homeopathy gives. So in the slideshow, I've also pasted the reports before and after the treatment. So fantastic result with a simple remedy like Drosera, uh, and uh, the prescribing is purely anamnestic. And again, when we talk about all these one-sided disease conditions, or which Pierre Schmidt calls as the defective illnesses, they have very, very few symptoms, but then you need to prescribe the indicated constitutional remedy. Only then will you be able to uh, you know find results in some patients, or these kind of patients. So, you know, so another case that I will share with you is of this gentleman who is a homeopathic physician himself, and quite a renowned homeopathic physician who primarily consulted me for a condition called an ejaculation, where he had absolutely no ejaculation at all, and he was a diabetic for a very long period of time. He'd been diagnosed with diabetes when he was in his teenage, and thereafter, when he consulted me, he was in his mid 40s when he consulted me. He uh, had an absolute erectile dysfunction. There was absolute no erection. There was no emission. He said last he recalled having some sort of a seminal discharge about 5 or 6 years back, and thereafter there'd been nothing. Uh, he had had a late marriage because of the circumstances and situations in his life, and he was really struggling hard initial few years, doing multiple clinics to set up his own practice. And finally, when his practice started running, he had already reached his late 30s. um, and he said that I in the course of my hardship, I lost all my hair, I developed a belly, I became little flabby, so obviously I was less attracted to girls. So all the girls that I came across, so my parents brought to me, they completely rejected me for how smart I looked. And then he laughed about it, but uh, clearly he said that that I used to feel lonely at that point of time, because I had finally worked really hard, achieved all the success, but then I came back home to my parents, and I was the only child, and they really wanted me to get married. So there are more people at home, and somebody should be there. And I also wanted to share my life with somebody, but then it did not happen. And then he said, sometimes I used to think that probably it's my practice who's taken this away. And but fortunately or unfortunately, he said, what happened was that there's a family that I treated, and those family members, they asked me about my personal life, and then they had a distant relative, and there was a girl who was also educated and had developed a career, and in the course of that time she'd also entered her mid 30s, and they were unable to find a suitable match for her. And then they recommended, why don't you meet her up? And she's also a professional, not a doctor, a homeopathic doctor like you, but she's an engineer. And that's how they met, and then they got married. And before he got married, he told her that he had been a diabetic for long, and that uh, uh, so that girl had a past history where she had a failed relationship, and she had to undergo an MTP in that relationship. But then that's how it was. for her. And he said very, very clearly that, I've never had any relationship earlier, and this is the first time I'm going to have. And he said, uh, Dr. Gyan, just imagine to my chagrin when I got married, and I find that, I have absolute erectile dysfunction and I don't have any emission. And it's been years which have gone by. I've been on diabetes medication, the conventional medication, for a very long period of time. But I've been to urologist, I've been to diabetes specialists, I've taken many homeopathic medicines by myself, but I don't see any change. And my wife is very spiritual, very kind, and she never ever complains. But I feel guilty that I this is my situation and my condition. So, as the one of the most difficult people you can take a history from is a homeopathic doctor himself, because they do not give you symptoms; they give you symptoms from the materia medica or rubrics from the repertory whenever you take their history. So, what I got from him, it took me almost 4 hours to get proper history for him, because that's how he also spoke. And because he was a colleague and he was a little elder to me, so it was also difficult for me to be strict with him or stern with him and tell him that do not give me all that. So what I got from the evolutionary history was that his father was also a diabetic, his paternal uncle, paternal aunts, they were also diabetics. On the maternal side, there was just osteoarthritis. As a child, he had suffered with uh, nephrotic syndrome for many years when he was growing up, and that recovered when he was about 9 or 10 years old. And thereafter, he was prone to cold and cough. And he said that persists even now. If I have an ice cream or if I am exposed to too much of cold, and he said, I am invariably exposed to a lot of cold because I feel extremely hot. Over last uh, 2 decades, if I compare, I become my thermal reaction has hit the extreme heat. I cannot tolerate heat in any form. The moment the summers start coming up is when my problems start coming up, because he said another thing, which started early in my childhood and which persists even now is my tendency for prickly heat and summer rash and um, boils and furuncles, which have been developing. And the moment summers come by, they keep on increasing. And at times when my sugar levels are high in summers, because I'm extremely tempted towards mangoes, and I have them, and then my skin is very, very bad. There is pus oozing, there is a lot of blood, lot of pus coming out, and summers are the most difficult time for me. So, I have to stay in AC all the time, even in winters. My wife sometimes, has to scold me to switch off the AC, because that is the kind of heat that I feel in my body. And this was the thing. And his sensitivity to cold, he said, it always starts with the sore throat, and then it goes to a cold, and there's always a delayed recovery. And another thing he said that, I apologize to you, but I really cannot bring myself up to taking the conventional medication for diabetes, which I have to, because I have very odd working hours. I'm never able to maintain a regular eating pattern. I'm unable to go for exercises because I work from morning 10 o'clock till about 11 o'clock or 12 o'clock at night. And, everything is haywire. Probably I have my breakfast and, then I directly have my dinner at 12 o'clock at night. I do not have anything over the entire day. And if I take a hypoglycemic drug, then I go into hypoglycemia, and there are other challenges that come up, and my work suffers. So when we got his HbA1c done at that point of time, it was about 12.1, which showed absolutely zero diabetes control. So that, and then his bowels were very irregular because of obvious bad lifestyle. There were some urinary burning and discomfort, which he often suffered with, and then that was also because of diabetes. He did not perspire too much, and he said that, that also happens because I barely exercise and I'm in a condition most of the time. So, and then, he had a very prominent frontal eminence, a very prominent parietal eminence, and his legs were, what we read in the, in syphilis, especially, we call them razor tibia, which is very, very thin and, pointed anterior edge of the tibia. And, uh, you know so and then there was his upper central incisors was quite widely paced, and he did not have a proper denture. His teeth had not come up properly. A few teeth were missing. So he said, when I count my teeth, I've got, instead of 32, I've got about 24 teeth in all. um, so, given very strong syphilitic features and the fact that, his skin complaints approached, especially with the onset of summers, and his sensitivity to cold and sore throat, his lifestyle and his habit, which was also so strongly syphilitic. There were two remedies which primarily came up in my mind. One is called Kali iode, which is also considered to be a very hot syphilitic remedy, and Kali bichromicum. Um, so I read through both of them, and, considering the fact that summers, with the onset of summers, many skin ailments came over. So I decided to give him a dose of Kali bichromicum 200, and I told him that, I want you to take a dose of Kali bichromicum 200, and I want you to promise me that you're going to make an effort to improve your lifestyle and improve your eating habits. I had a word with his wife, told him, this is how you feed him: small meals at small intervals. You'd probably have to go to his clinic, stand on his head, make sure that he eats. And she did make the effort, and he got a dose of Kali bichromicum 200. And about 2 months later is when he called up, my skin is really, really bad. I did not call you. Uh, but the most interesting part, which I wanted to tell you, is for the first time in many years, I had a seminal emission at night during sleep and during dreams. And thereafter, his erectile dysfunction gradually disappeared. And by the end of 1 year, that is exactly 13 months later, after that one dose of Kali bichromicum 200, is when his wife conceived. About 7 months into the treatment, after that one dose of Kali bichromicum 200, he was able to have a regular sexual intercourse with his wife, and that was what he was grateful for. And he invited me when the child was born, and he said, we're Hindus, but I believe that you're the godfather of the child. It's just the respect and honor that he accorded, and the fact that, Kali bichromicum is a drug which is not often thought of in cases of infertility in homeopathy. But remember, it's not infertility that we treat in homeopathy. It is a patient who manifests or presents infertility that we treat in homeopathy. And that is the kind of result that I had with Kali bichromicum. Dr. Amita, how much more time do we have? You'll have to tell me, please.
So you please continue, because I don't want that you should get interrupted in between as the session is going on. I think you have case to show as well, right?
I just have this one report of azoospermia that we treated, and this other patient that I discussed is something, that I just wanted to share with you. It's going to be published. It's under peer review process with the journal, so I can't really show this patient, and there's not really much to show in this except the cases that I'm going to talk about. It's just my clinical experiences that I wish to share with you. um, Hardly anything else that, that we can show in such cases. So just let me know how much more time do I have, and then I'll stop.
So, because we started 15 minutes late, so you still have 10 minutes, 10 to 15 minutes.
Okay, fine. So, you know, these are two cases that I wish to share with you. Uh, Initially, when it comes to the male infertility. So, uh, uh, can we move on to the next slide? Okay, next, please. Next, please. Uh, Next, please. Next, please. Uh, so you need to create that bonding in order to understand the psychological factors, um, the the feeling of shame or guilt or the different stages of grief. Um, that's something which as homeopaths we are all aware of and which we always do in our clinical practice. Can we move on to the next slide, please? Next, please. Yeah. Next, please. So that was the first case of, Drosera that I shared with you, where there was absolute no sperm cell that was seen in the entire field. Next, please. And that was, when he had a 12 million sperm count, uh, that came about. Next, please. So that was the second case that I shared with you. Um, so this was a case of infertility that I treated a couple of years back, again, which was referred by a colleague of ours who had been treating her for a short while already. And she was an engineer also by profession. And she had secondary infertility, and she had been through uh, the regular conventional treatment and like I said, the homeopathic treatment as well. So primarily when she consulted, considering that she was already in her late 30s, her AMH levels were also going down, and she had tried IUI, but that had also failed. And uh, thereafter is, on the recommendation of a colleague of mine, she consulted me. And when we went into the entire history, what we found out was that she, had recurrent episodes of UTI, and every time that she passed urine she felt that there was a sort of a bubble that was passing out, um, uh, and then uh, her periods otherwise were slightly delayed, and she was also prone to recurrent episodes of sore throat and body ache. And uh, so at times she also felt that whenever there were periods going on, she felt that uh, with the flow of the blood and sometimes with the vaginal discharge also, she felt as if there was a bubble of wind that was piping out from the vaginal region. And she had consulted many gynecologists for it, but they said that you possibly could be having uh, bacterial vaginosis, which can produce this kind of a condition where you have some infection inside, and that might lead to a bubbling sensation. So in our traditional materia medica, they call it physometra, or but in the modern medicine, they call it the vaginal flatulence. And like I said, this seems to be one of the reasons. The bacterial vaginosis seems to be one of the reasons for it. So she also had a preference for sweets, and she preferred her food and her coffee and tea to be warm, quite warm. And so we gave her a dose of lycopodium 10 a single dose of that was prescribed, and I think it was span of about 3 months with the placebo going on, and then she conceived absolutely naturally. And going through the history, finding out the totality of symptoms, and I believe that what is very very important is also the aphorism 7 of the organon, that you take the entire history and you find out all the symptoms which are arising because of the exciting or maintaining causes. Like, for example, in that case of Calibicromicum, his sugar levels were fluctuating because of a bad lifestyle. Now, what was genuinely required in that colleague's case was to, somewhat improve his lifestyle, whatever was possible, because he himself was unwilling to do that. So all those symptoms which come up because of exciting or maintaining causes, they are not to be considered for when you frame the totality of symptoms. And if you look at the entire portrait of disease at that matter, that the entire jumble of symptoms or history that you get after the case perceiving, if you pick up only those symptoms which have come up since the onset of ailment, or have come up since have come up as a concomitant to the main problem, then those symptoms are what that ought to be considered, and every other symptom which are because of a bad lifestyle are to be eliminated, and the patient has to be counseled to improve the lifestyle in whatever way possible. And only those handful of symptoms which we call the characteristic totality of symptoms are what ought to be considered for prescribing. I personally, in my own clinical practice, I have never ever used 20 symptoms for repertorization, or not even 10 symptoms for repertorization for prescribing. Also, we just have a handful of 4, 5, 6 symptoms. And it is likewise when it comes to repertorization. We just repertorize those 4, 5, 6 symptoms which form the characteristic totality of symptoms, and you prescribe the remedy, which itself is very, very obvious. There's another case, that was referred to me by another class fellow of mine who also studied, but then she moved to Europe, and then she settled there with the family, and she stopped practicing homeopathy. And her sister-in-law is the one who, after marriage, and had been married for about 6 years, and had 2 failed IUI, 1 failed IVF, and eventually, the doctor said, you can probably go for another IVF, but the girl was ready for it, but the husband and the in-laws, they were concerned because during 2 failed IUI and 1 failed IVF, she had gained almost about 15 kgs of weight, and she had lost a lot of hair, and she had developed a lot of bodily hair. Her body had become quite uneven. Her muscles had become quite flabby. Her body stamina had gone down. She was also becoming more and more prone to sore throat and cold, and fever at every change of weather. And that's something the husband and the in-laws noted and pointed out. And then they spoke to this ex-class fellow of mine, and she asked her to reach out to me, because she was staying in Mumbai, and then they flew down to Delhi. And so primarily, after the treatment for IUI and IVF has started, she was, like I said, more prone to infections. But as a child, also, she recalled that she was always having a very sensitive throat. And very sensitive throat means that every time she would catch a chill, or she would have maybe a glass of cold water or an ice cream, or have something which was too sour, and would always first cause a throat pain, and that would be followed by high fever. But initially, the episodes were maybe twice a year or thrice a year. But last few years, ever since she'd been under the fertility treatments, they've become more pronounced. And apart from that, her menstrual cycle had been delayed since the puberty, always coming in about 40 to 50 days. They would always last for about 2 or 3 days. And, her parents considered that it was perfectly normal, because they were coming regularly at 40 or 50 days interval. And after marriages, when they started going to the gynecologist, is when the gynecologist pointed out that you've got delayed cycles. They did the ultrasound. She was seen to have polycystic ovarian syndrome. Then they initially gave her contraceptive pills for a couple of months to regulate her cycles. And when they became regulated, that's when they started trying to conceive. And then this, so on and so forth, things happened. So apart from that, as a child, she was also she suffered with some sort of itching eruptions in the feet, which stayed for a good 8 or 10 years. And she said, I tried applying different powders which the doctors gave to me, possibly antifungal powders. She said eventually, then I was giving a lot of ointments. And finally, say about last 7, 8 years, she said she'd been free of all those skin problems in the feet and toes, that itchiness. So possibly she suffered with a form of athlete's foot, and that went away with the conventional, the topical therapy. And eventually, that's all. And uh, what was more interesting was that her husband and the in-laws, they were so concerned about the changes that had taken place in her entire personality and her energy levels and her physical appearance. And she was quite oblivious to that fact. Apart from that, she had become chillier in last few years than in, she said, in my childhood. And that being said, and so about 4 years before she visited me, she had a pain in the abdomen, and they did an ultrasound, and they found gallstones, and she had laparoscopic cholecystectomy. Her mother suffered with high BP. Her father also suffered with high BP. One of her paternal aunts also suffered um, um, with infertility, and eventually she had adopted a child. So her parents were quite concerned about that. But that girl, on her face, she was oblivious to the fact how her personal appearance was. She was not too much concerned about the fact that, there was a family history of infertility as well. In fact, one of her maternal aunt also had adopted a child when she failed to conceive after 15 years of marriage. Um, and then, the fact that she was ready to go for another round of IVF without giving it too much importance or weightage, how her body has suffered, or how it had taken a toll on her body. Um, Another thing, which had happened after the last IVF was that her cholesterol levels had also gone higher. So they had also put her on the statins to control that. So, this entire phenomena, that how she had a sensitive throat, which had also become a little more pronounced in last few years, and the fact that, she had become oblivious to the fact, how it had affected her. She was prescribed a few doses of Berita Carb 30. She received that thrice a day for 3 days. Not only did it take away her tendency for sore throat, but 3 months after Berita Carb, and she tested positive naturally, did not require any repetition, and went on to have a normal delivery later on. So these were just a few experiences I wanted to share with you regarding infertility. And if you have any questions at all, please, I'm here to answer anything. Thank you.
Thank you so much, Gyan. This was a surprise, I think, for all of us कि जिस तरीके से आपने काली बाइक्रोम का और ड्रोसरा का बताया, because we cannot think of infertility cases like that. So this was really an eye-opener session. I request Dr. Muktinder sir and Dr. Wahi sir to give their remarks on the presentation by Dr. Gyan sir. Dr. Wahi sir, you can unmute yourself, sir.
Yes, I have already unmuted. Am I audible now?
Yes, sir. Yes, sir.
In the very first introduction, when you refer to the sketch drawn by where you mentioned regarding the process of fertilization, as you know, which failed to him, I would put it. I was reminded by one, Dr. M.P. Arya was taking some lecture. I don't know whether it was at KML or at some other platform. So at that time, he remarked, sex of an individual lies in the brain, not in the genitalia. So what I feel, maybe that was the thought prevailing with MC. So he drew that sketch. I knew that was a separate, something different. But this it came to my mind at that time.
Sir.
And regarding infertility, as you said, yes, it has become an industry, and I really do not know. Like many other things, whether it is vaccination, or it is cancer, or it is diabetes, or cardiac problems, which all have been, and diagnostics, I mean, everything has become industry. And to what extent they have really been able to do justice, it is anybody's. At least I would always say with a question mark. And the real treatment, of course, it goes, and as it has been given by Dr. Gyan in two of his lectures, two of his presentations, Caribacum or the Drosser case which you mentioned, that is the real thing. Just a minute, can you? Good evening. मैं दोबारा मैं फोन कर देता हूँ, ठीक है ना? अभी वो प्रेजेंटेशन में डॉक्टर गैन, हाँ बस वाइंडिंग अप कर रहे हैं, मैं अभी कर रहा हूँ।
सर आप प्लीज मेरे को ज्ञान ही बोले, डॉक्टर ज्ञान मत बोले, प्लीज ज्ञान ही बोले सर, तो आपके लिए बच्चा ही हूँ सर।
कोई बात नहीं। So, and biggest threat over this infertility clinics, etc., they are concerned. They are all doing, or I would say, they are treating the result of the disease, not the disease in itself. So that is why it will remain industry, and I don't think it will really do the work for which they are being established. Oligospermia, of course, I mean, I still remember a case of my own classmate, maybe 1 year senior to me, when, there was an history of repeated, failures in such cases. And oligospermia was there. Isospermia, of course, even so far, I have not got any results so far. But oligospermia, and especially in cases, where there were a lot of the mutations, there were a lot of problems that, they were not properly formed. So I have an experience of giving luticum in these cases. But then, what I used to say, okay, once, they are having, even if some delay in the stress, in the period, and we are suspected it is so, initially, when we gave luticum to wife, of course, when case it was confirmed, but otherwise, to both. So that has definitely helped. Much more experience, of course, even I don't have, and Azoospermia, well, so far as I'm concerned, I have yet to find a positive response so far. That's what all I have to say. But your presentation has been really very absorbing. And although it is the time, by this time, when I go to sleep. But it has been so absorbing that I'm still very much on the chair and listening to it.
Thank you. Thank you so much, sir. Thank you.
Dr. Muktinder, sir,
Yeah,
over to you. Kindly unmute yourself, sir.
Yes, good evening to all. I have been listening to Dr. Gyan for the first time in my lifetime, and I have been watching him because Dr. Aditya Kaushik and the Delhi, the Farrington Materia Medica studies and all that. But I was always curious to uh, listen to his wisdom. And today I can just comment this way that yes, he has qualified the Dr. Henneman's basic qualification of a homeopath of being unprejudiced. Because this I have felt and I have realized in my own practice. The cases where you succeed to stick to this unprejudiced, the wonders follow. The moment you leave this basic trait, being a homeopath, you always get stuck up in one or the other things. So bravo and congratulations. A lot of blessings for Dr. Gyan. And I wish that you can further carry on this divine blessing. So I always say to my students and to everyone that being unprejudiced is the ultimate blessing we can get. And then homeopathy flows through you. You won't carry homeopathy, you won't study homeopathy, you won't apply homeopathy. Homeopathy needs the like siphoning. The homeopathic wisdom flows through the moment you just look at the case as it is, not the way you know it, not the way you want it to be, not the way you as per your experience. When you see a case and your Drosera, your Kali Bichrome, the other cases were the clear-cut examples that you have not in mind the pathology. You have in mind the anamnesis. So I really congratulate you and I wish you a great success. Thank you. Thank you, sir.
Thank you, Dr. Muktinder, sir. Dr. Daryani also want to express something. So we will request Dr. Daryani, sir, to unmute himself.
Am I audible?
Yes, sir.
Yes, yes.
ज्ञान ने ज्ञान की गंगा बहा दी. I think this is sufficient. What I say. Today I learned from you, my dear. You were given a good surprise. But I must advise you, there is justification of medicine. Why Kali? Why? Why Drosera? Why not tuberculinum? If it is psychotic and mixed miasm, why not Madorinum? And lastly, there was one more important point that in between you give the sore throat related problem, Brighta carb. Now, this is something very new that you know, but what they learn others. Person like me, I couldn't understand. Person like Dr. Bai, he couldn't understand. शाबाशी देना तो सबको आता है, पर बच्चे की शेप को देखना वो एक टीचर का धर्म है, जो मैं अपना धर्म निभा रहा हूँ.
बिल्कुल सही कहा.
Justification of medicine and selection of potency. On miasmatic evaluation, now which is predominant and which is in that way? Because you already mentioned a thorough knowledge of aphorism 6, that is, every practitioner should follow. 7, it is maintaining cause, exciting cause. I do agree. But overall, justification, because the learners and beginners or budding homeopaths, they will learn from this type of lectures. They will appreciate this type of lectures. As I say, ज्ञान ने गंगा बहा दी, ज्ञान की गंगा बहा दी.
अगर एतराज ना हो तो दिरानी जी, मैं एक बात जरूर कहना चाहूंगा कि एक इम्पोर्टेंट फैक्टर, और जो कि ये दिन पर दिन बढ़ती जा रही, हम लोगों की लाइफ जितनी यहाँ पर एटलीस्ट इन दी अर्बन सिटीज जो स्ट्रेसफुल लाइफ होती जा रही है, एक आइसोलेटेड फैक्टर नहीं है. तो इसके अंदर है, वहां पर स्पेसिफिकली वो केस उसके हिसाब से ही तो चलेंगे ना.
Sir, my point is entirely different and entirely different. What I mean to say, he should clarify why not tuberculinum, having the past family and past history of tuberculosis, why Drosera? This is the main point.
No.
Similarly, one is chilly, but wants heat. That is syphilinum. Mixed miasm, madorinum. Syphilitic is again Sora and syphilitic. Why he has given the Kali carb, Kali bichrome or bright up. Psychotic miasm considering polycystic ovary, gallbladder stone, and all other things, keeping in view that miasmatic analysis and that medicine should be justified on all 2 grounds. This is my humble request. Because ज्ञान की गंगा और बहेगी अगर थोड़ा सा इसको पॉलिश किया जाए. That's okay, sir.
I understand, sir. मेरे को और ज्यादा explanations देने चाहिए. ये बात सही है.
थैंक यू सो मच दयानी सर. एंड क्योंकि टीचर्स गाइड करते हैं, सीनियर्स गाइड करते हैं, तभी हम लोग अपने आप को करेक्ट कर पाते हैं. सो थैंक यू so much for your views. Now, on behalf of International Homeopathic Foundation, I sincerely thank Dr. Gyan for his presentation, for his efforts he has presented today. And definitely it was a very different topic. इसमें केस हिस्ट्री, केसेस एंड जो कम्युनिकेशन पेशेंट के साथ होता है, so that is on a totally different platform. Thank you so much, sir, for your time, for your guidance. So thank you everyone for your kind presence, and we are there on social media platforms on Instagram, YouTube, Facebook. Our website is very much there, that is www.ihfworld.org. Our next webinar will be on 22nd of December, Friday, 8:30 p.m. to 9:30 p.m. again with Dr. Abdikwam Chimtanwala with the topic Treat ADHD with Homeopathy. Let's offer the solutions. So we look forward to meet you again. Once again, thank you, Dr. Gyan sir, all the doctors for their presence, students, practitioners, and team IHF for their efforts in making this webinar a successful webinar. Thank you, everyone.
Thank you. Bye-bye.
Thank you.
Can I stop the recording now and leave the meeting, sir?
Sure.
Thank you. Thank you, Gyan sir. Good night, everyone.
Good night. Good night.